Q. So, all right, so my name is Phil Cox. I'm the Director of Security and Compliance at RightScale, and this talk is HIPAA in the cloud. The rules have been set. If you have questions during this, please pipe up. Again, this is kind of a small audience. This is a very interesting thing. We'll go through that. So, somebody's comment. So, January 25th of this year, the Omnibus Rule was finally released. The final rule, which basically said everything that's been interim rules from HIPAA in, 96, and the HITECH Act in, I believe it was 2009, right? All of those interim acts, everything, this is what it means. We set the final rule. And most of this is about that and not specifically cloud, right? We'll talk about how that applies to cloud, but for the most part, cloud's just a technology and where it sits. The HITECH Act was the I just remember the acronyms. It'll be in 2 slides. So HIPAA, Health Information Portability Act, 96. Title II is the things that we really care about because it was talking about preventing healthcare fraud and abuse, gave some administrative simplification acts and some liability reform. The simplification acts are also known as the security rule, the privacy rule. Security rule, the privacy rule, and the breach notification rule, which is really the things that matter. There's a bunch of stuff about marketing, what you have to do with all of the information, how you control it. There's a couple thousand pages of these things, but it gets down to good security. HIPAA was in 96. The whole purpose of it, which is from my standpoint, was a good thing, is sharing healthcare information. Quick story, and I think actually a couple of people have probably heard this already. My wife is an oncology nurse, and so we were sitting at dinner the other night, and she was talking about charging. One of the things that she has to do when she gets done all day giving drugs and stuff like that is she has to sit down and chart and charge and say, was this drug, did this thing, was it the right one, was it here, are they on Medicare, is it the right, blah, blah, blah. All of that she has to put in so people can get paid. And she was just like, all the information systems that she used, there's just nothing that combines. And I'm thinking to myself, those are the things that HIPAA is supposed to help us kind of coordinate and make things better. So from that standpoint, I am a little bit jazzed into working in this because I do think that it's going to help people in the real world. So again, the 3 main rules that we care about from HIPAA that affect us are the privacy, security, and breach notification. And we're going to talk about those more specifically how the Omnibus Rule changed some things or solidified some things that I think are most important. If we can talk about other things, but it's the ones that I looked at and said, these are going to bite people. So the privacy rule, and some of this, all of you who are HIPAA experts, this is just background. I want to make sure everybody's kind of on the same level set. Privacy was about preventing unauthorized disclosure. It's like we don't want people to know about other people's healthcare information for a number of reasons. So the privacy rule is all about that. One of the biggest things that we'll talk about that changed or that was solidified in the Omnibus Rule is about the marketing, the use of information for marketing, and who can contact who, and whether. One of the things that was interesting to me is that if you pay out of pocket for a medical service, right, there is a significant restriction on who gets information about that. Your health insurance has no right to anything that you've actually paid out of pocket for. They can't get that information. The HIPAA privacy laws prevent that. So again, things like that I thought were pretty interesting. The security rule is about kind of the technology. It's how do we actually do the security of this information to implement, for all intents and purposes, the protections of the privacy rule. And then the breach notification is mostly about telling people, if you expose data, what are the requirements to let people know? So HITECH was, actually, I don't even write what HITECH is. It's like the health information. Does anybody in the audience know the acronym? Don't look it up if you don't know, because I don't either. But it was part of the American Recovery and Reinvestment Act of 2009. The thing about HITECH, HIPAA said this is what we want to do, and people were like, what if I don't do it? What happens? There was nothing in HIPAA that actually had, had teeth in it. The HITECH Act said, okay, you don't do it, we can fine you. Right? It basically, it gave the enforcement rules to HIPAA, which is kind of interesting because you look, 13 years after HIPAA was written, right? There was finally a reason for people to do it, as opposed to, the analogy I have is, I'm driving down the freeway, the sign says 55. If I know there's not a cop on I-5, which goes basically from, the Canadian border all the way through Mexico, and I'm going to Southern California, I'll go as fast as I can, but because I know that there is an enforcement somewhere along there, I don't do that speed. So it's kind of interesting that it took 13 years to actually say this is what we want to do. So a little bit on the security rule, again, mostly to try to level set this, is it wanted to ensure confidentiality and integrity of the electronic protected healthcare information. Again, a little caveat, privacy deals with all types of protected healthcare information, which really means anything about your health service. But it's hard copy, anything, the privacy rule. Security rule really deals with electronic. So if it's in electronic form, which is, again, the things that we do, I want you to be able to identify. So the interesting part was confidentiality is identifying and protecting its reasonably anticipated threats. So you have to actually think about who could get access to your data. There is a risk assessment part of these things. Anticipated and permissible or impermissible use and disclosures, protect against this. If this happens, right, that's when the breach notification rule kicks in, and there's some requirements on that we'll talk about. The interesting thing too about the security rule, as well as the privacy rule, is there are these things that are called required and addressable, right? If it's required, you have to implement what is specified in the simplification rule as there. If it says it's addressable, then similar to PCI, you can meet basically the intent, the original intent and rigor of that control. So it matters because when an auditor comes in or somebody comes in, if you have a breach and they look at it, did you do what you needed to? If it was a required rule, did you implement it? If you didn't, you're in a lot of trouble. If it was an addressable, was it reasonable? So just realize that there are some things, you have to know which ones they are, that you can kind of make appropriate controls around, and then there are others you have no option. You have to do what they say. So a quick rundown of the security rule again, since most of it affects us. Risk analysis. So if you're not doing a risk analysis, back to that threat, you have to know what your threats are. It's part of the risk analysis. You have to do that. There are administrative safeguards. So you have to have policies. There's stuff that define roles. And all of this, you could cover HIPAA and say ISO 27001, PCI, any security program or compliance program, same type thing. Physical safeguards, facility access control, workstations, technical monitoring of access. One of the things that I talked about in my PCI talk yesterday is that monitoring of people doing stuff tends to be where a lot of people drop the ball. We have access controls, we look, and then it's like, well, when was the last time you checked to see who logged into that database server? Who did this? People just aren't doing it. They may have logs of it. Part of HIPAA is that you have to be doing that. You have to have the monitoring. And then organizational requirements, covered entities, and this is the kicker. This is the kicker of the Omnibus Rule, is covered entities, right, must manage their business associates. And we're going to talk a lot about business associates. And some of you, has anybody in here actually read the Omnibus Rule or any summaries of the Omnibus Rule? Okay. Then this will probably be new to everybody but you. And then policies and procedures. And the interesting part about this is that all of these documented policies and procedures you have to keep it's like a 6-year. It's kind of like United States IRS, right? They can go back 7 years of taxes, right? For this, you have to keep policies and procedures for 6 years, or even when you archive them. Forgot to add those. Actually, I have another set of slides. Thanks. So we'll go through this. The Omnibus Rule change, right? It set the rules for the final thing. The biggest item was the business associates Then the state law preemptions and definitions. Oh, so I'm gonna take just a second to give everybody. You're gonna see 3 of these slides in here, right? I went through actually a course, a speaking course, and part of the thing is hitting your main message, right? So people know. And this is the thing. HIPAA compliance in a public cloud is achievable. Right? That is like the main theme. That's what I want everybody to kind of understand, that's it. Yes. When everybody walks out of here, if somebody says to you, you can't do HIPAA in the public cloud, it is patently false. We can do it. So with that, when you see this, hopefully that flashes and sticks in your mind. So the punchline, HIPAA in the public cloud is about business associate agreements. It really, really boils down just to that. The business associate agreements are super important. Other things, proper system access, application security, those type of things will matter. You know what?
Business associate?
Sorry. So we're going to quick HIPAA. Business associate. That was a setup. I paid him before we started this. So by HIPAA law, the privacy rule only applied to covered entities. And covered entities are like healthcare providers, insurance companies, a couple very, very limited, really specific to healthcare. Well, business associates, right, were these people that did things. You have a partner, you have a subcontractor that helps with your processing, your payment processing, your coding, whatever that happens to be, right? The privacy rule says, a covered entity can use these, and the key words out of the privacy rule, they're allowed, right, if they obtain satisfactory assurance that basically the business associate will safeguard and comply with the privacy rule. And again, if you think back, we talked about the privacy rule, the security rule, and the breach notification. Both the breach and the security are all about enforcing and making sure the privacy rule mattered. So that's why, when we think about it, the business associate was focused on the privacy rule as well as the covered entity. So who's a business associate? Anybody is anybody here familiar with PCI? A little bit? So, receive, transmit, all that type of stuff. So business associates receive, maintain, or transmit protected health information for a covered entity. That's the definition of a business associate. Basically, if you perform some type of function, right? And so the Omnibus Rule specifically called out. So you had these things that were there. The Omnibus Rule specifically called out these patient safety organizations. So you're an ambulance company or something like that does some patient safety. There was some, and I've not, it's kind of like I'm not a lawyer, I don't play one on TV, but sometime in history there were questions. It's like, we don't receive, maintain, or transmit the protected healthcare information. We've just got the person we're putting in. No, not anymore. You fall under this definition. Now you're considered a business associate, and the business associate agreements and your requirements and liabilities, which we'll talk about in a little bit, become there. Health information organizations, e-prescribing gateways, other persons that facilitate data transmission, vendors, and subcontractors. And the Omnibus Rule is very, very specific about it is recursive. It's like, if you're a business associate and you have a subcontractor that falls into any of this stuff, you have to have a business. They are now business associates. If they have subcontractors, they're business associates. So this liability and that chain of business associate agreements need to be there. There's direct liability now for these people. Again, most of the HIPAA change in the Omnibus Rule that I saw was all about who is this business associate and what does it mean to them. When you read the HIPAA regulations, HITECH, there was an exception for incidental and conduits. So it says persons or organizations like a janitor whose function or service do not involve the use or disclosure. So I'm a janitor, I'm cleaning up, you got a piece of HIPAA, and I move it, I'm exposed to it, but it's incidental. That's not part of my job. As that, I'm not considered a business associate agreement because my access is incidental. It's not part of what I do, so you as a covered entity don't have to have a business associate agreement with me. Cool. Right? And that's pretty straightforward. There wasn't a lot of discussion. The next one is the kicker. Person or organizations that merely act as a conduit for that information, right? U.S. Postal Service, I'm sending something. My healthcare bill that comes in the Postal Service, they're a conduit. An ISP has typically been a conduit. Almost all, and so actually I'm going to switch to this. You'll read it and I'll kind of describe it. The fact is that in the clarification, you read the rule, there were a bunch of people that had public comments that said, oh, I'm Amazon. I'm just going to pick on Amazon for a second. I'm Amazon. I do not access their protected healthcare information. I don't do it. I provide them storage. I'm Dropbox. They store the stuff in there. We don't do it. They encrypt it. They store it in there, encrypt it or whatever. We don't access it. Health and Human Services said no. Said if the data is persistent and you manage that, you are now a business associate. Really, conduit is transient data. So the big part that they talked about it, the difference between the two situations, transient versus persistent opportunity. So Health and Human Services, so anybody, if you store it, if it's persistent there, they are required to be, I'm going to kind of step back and this is my legal opinion from the non-lawyer. You can put healthcare information any place you want. You can decide not to have people sign business associate agreements and all of that stuff. If they lose the information, you're hosed, right? Because you are going to be liable for that, right? And Health and Human Services is going to come back, and you may not only be criminally liable, you may not only be civilly liable, you may be criminally liable because you basically have willfully neglected what they told you to do. So from that standpoint, people like all the cloud providers, because they have data stored there, any place, Dropbox, all of that stuff, they became business associates. And now they're subcontractors. So if you're going to use somebody, you need to get them to sign a business associate agreement. I know that I talked to, I think it was at AWS reInvent, and I was talking to somebody, and they happened to, at that time, they were using Amazon as they were storing EPHI in Amazon. They were using them. And I said, wow. I said, how'd you get them to sign a business associate agreement? Because they won't. And the guy was like, we didn't. Our lawyer looked at it and said, we trust their controls, and this was before January 25th. We trust their controls, so we're willing to accept the liability. Right? And up to that point in time, there was nothing that said, thou shalt. Now there is a thou shalt. You have to get a business associate agreement, or, again, you're effectively breaking the law. Before there was gray area, now there's not. So BAA is optional. If you go to page, so if you get the Omnibus Rule, it doesn't start at page 1. So that's a little bit of nice thing. But if you go to page 5,591 and you look at the comment on it, it says, hey, shouldn't the business associate agreement, right, be an addressable requirement under the security rule? And the Health and Human Services says, blah, 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 blah. We decline to make the execution of a business addressable. That means that somebody asked, hey, can we do this? Could we have a reasonable alternative? And the Department of Health and Human Services says absolutely not. Again, most of this I keep kind of harping on it because really this is probably the biggest thing that came out of the Omnibus Rule to me that affects your ability to do things in the cloud because of the partnerships that matter and people that are willing to sign things and those type of things. So it does bring it brings just some challenges, some real challenges, and they're not technical. They're all, so, if you decide to forego the business associate agreement, make an informed decision. How good do you look in orange, bright orange? You sport a nice bright orange. So one of the things I wanted to comment on, and I actually got a partial legal opinion today on this. So I feel even more empowered to say this, is that the good news is that, a lot of your cloud providers will probably sign this. This is the cloud providers themselves. Azure will sign a BAA. Microsoft will sign a BAA for you and do that. Data pipe will do it on a case-by-case basis. And obviously, I'm picking public clouds that RightScale supports. There may be others that we don't, but I wouldn't want you to use them. AWS has no public statement on that, but I do know of at least one customer that has gotten Amazon to sign a BAA. So, I think if you're big enough and you push hard enough, you can probably make that happen. Google Compute will not at this time. Neither will Rackspace and neither will SoftLayer. Rackspace may in their managed services portion, in that, so you could do a Rack Connect, but again, I'm purely talking about public cloud. In the public cloud part they won't, and SoftLayer won't at this time either. So any questions up to this point? Oh, Sean.
Thanks. Great job, by the way.
Oh, we're not done. He's going to hate me in a few slides.
There are a couple hosting companies that put out a badge that says we are a HIPAA-compliant hoster or cloud company. And does that alone subject them to anything? I don't believe so, but curious for your thoughts on that. And
okay, so the question is I look at a hosting provider and they say, we're HIPAA-compliant. What does that mean? That doesn't mean diddly. It doesn't subject them to anything or mean anything to you. I could have a T-shirt that says I'm HIPAA compliant, right? It doesn't matter what would, to me, when somebody has that, yeah. What I'm guessing is that means, when I ask you to sign our business associate agreement that you're going to protect it, that you're not going to get any pushback. That they're going to have understood the security, privacy, they're going to understand the rules. They would have taken the time to walk through that, make sure their environment would meet those requirements for you, and that they have no problem signing that business. That is a pure conjecture, but that's what that symbol should mean. What it does is it may be, we're going to put this here so we can get somebody to actually come talk to us.
Gotcha. My other question, hopefully a quick one, is there any gradation in your liability exposure as AWS or as an Azure if you sign an agreement? Is there any gradation in that depending on how small or how big, whatever it is that they're doing?
So interestingly enough, the actual I don't want to say exposure, but like the fines that can be levied and all of the stuff really is about, if you're a smaller organization, they take a lot. So risk-based is a big part of HIPAA. So there's some of that, but I'm not sure I really understand the question, but in terms of, as a cloud provider, this is kind of my general rule. Right now is if you store the data, HIPAA says now that you have to sign a BAA. You have to do it. If you are doing reasonable security things like you should be, there's no technical reason why you shouldn't want to do that. You want to make sure the language in there is correct, right? Just in case some bozo does something wrong and causes something. But for the most part, I don't see why any of the cloud providers that I listed, I think it's purely because their legal departments haven't just kind of went through it. But all of their security that I've talked to would meet all of the requirements for HIPAA. And again, at this point, it's almost like nobody realizes that Health and Human Services has said, guess what? There is no more addressable. There is no more, we'll just accept the risk. It's like the company that does it is in trouble. Yeah.
How does, on the slide where you were comparing the transient versus persistent,
yes.
It does mention the company that has access to protected health information. So if it's encrypted basically before it gets to whatever public cloud, and it's only accessible after being decrypted on the other end of it, would that still require it?
So, great example. Let's say that you use S3, and you don't use server-side encryption, right? Because then Amazon would have the decryption keys to be able to get to that. You encrypt it, and it's basically a data blob that sticks up there. And then you pull it down, and then you do it inside your data center or whatever. Then it wouldn't be protected healthcare information. It'd be a blob that you store in S3. But then you wouldn't be processing HIPAA data in a public cloud. And that's why I'm saying, when I look at things, one of the things, RightScale, we don't have any servers. For our corporation, for anything, everything we do is either SaaS or in the cloud. So it's not like we've got that. So when I look at these and when I'm talking about it, I really do mean you're doing all your HIPAA in the public cloud, and these are the things. Does that make sense to answer your question? Mm-hmm. Okay. Sean, I think right there. Oh.
Just interested in September 23rd and what's going to happen. Is there going to be a whole lot of spend on wholesale data center space or cloud adoption, or is there going to be a gradual crescendo until that date? What's
So he said September 23rd, which is kind of stealing a little bit of my thunder of the slides that are going, because as of January, there's this 180-day rule. And by the way, 180 days, if you have to deal with HIPAA, that should stick in your mind, because that's the way they make a change. Somebody asks, oh, the rules are finally set. And I'm like, this is politics, right? It's never set. When they change the rules, whenever that is, when the new rule comes into play, you've got 180 days to implement it. So that 180 days is, I have no idea. If people drag their feet, if they drag their feet and don't read this and come September, again, something may never happen. If you never get a breach and you're small enough and there's no political somebody who wants to see you go down, you may never get audited. Something like that may not happen. I mean, a lot of this, because the department, it's kind of like the IRS. You can cheat on your taxes all your life, and you may never get audited, and it may be there. If you happen to be the poor schlep that cheats on his taxes and they audit you that year, then you're host. So very much, the consequences are kind of up in the air. If you get breached, then, obviously, if you aren't implementing this and you get breached after September 23rd, you're hosed. Hosed in a legal sort of way. Yeah, Paul.
So I understand the BAA to be really just a liability contract, insurance policy, really, that a person's taking
in a sense, yeah.
So what is it that the provider is actually taking liability for? What type of breach is it? What if someone that they're supporting has access to the data and actually takes it and just redistributes it improperly? Is that provider liable for that?
So if part of their responsibility was to control that. So let's, again, I'm going to use Amazon as an example just because everybody's familiar. Or it doesn't matter. It's in a block store. It's in a store. It's in S3. I'm just going to use that. It's in S3 and it's unencrypted, right? So it's protected healthcare information. It falls into that category. If the controls around S3, the authentication controls that I rely on to protect that data, if they're compromised and that data gets compromised, Amazon would be reliable for it. If, on the other hand, I put my S3 credentials out on Pastebin and somebody uses it to access it, then it would be on me. Does that make sense? So it's kind of where the control is and what you're only responsible for what you're really responsible for, in that sense. Andy?
Sure. I would like to share a little bit more. I'm from 3M Health, so where it just happened so that I was in a compliance audit from an external company because they use our product. And to be HIPAA compliant, it's not about, I would say, about slides and documentation. It's about a set of questionnaire that if I'm providing a service to a client who has a PHI or has a public protected health information, they have to come. They have their own standards what they define. And typically, when we kind of answer those questionnaires, they are mostly revolving around the security, who has access, how do they get it, how do we log it, how the approval process work. Second is compliance, encryption, as a gentleman was just mentioning about it. How do we encrypt it? How the password sharing is happening, backing up, or the product that they're using, how it makes sure the most stable product through a very stringent, strong SDLC process kind of stuff makes it to the production, and who has a production access. Can you give us a log, security? And I have an email from an external auditor. It's one of the big hospitals in the Boston area that have sent me a questionnaire that we have to satisfy because they're using us as a SaaS and the software service, and they need to be HIPAA compliant. It's all, for me, the challenge is HIPAA becomes, it is getting more like a scary word than being actually a helpful word, right? It's for the help for the patients, and makes sense, but it's becoming a scary word in our domain. So it's their list of questionnaires. I just want to share with the audience here because we are satisfying it, and I didn't hear anything negative from them once we answered them. So it seems like they're HIPAA compliant, though they're in the cloud. So
Yeah, and and part of the point is what you just said was probably part of everybody's good security plan. Oh, you have access controls. It's those type of things. That's where it's not really, it really does get down to now who has to sign the contracts and people willing to do that. And it's only been since January, right? I mean, it's going to take some time for lawyer. I sat with our lawyer not more than a couple hours ago to go through. No, ours is probably at the end. I'll give the punchline. So I sat there. Does RightScale need to sign a BAA? That was the question. And because of the way RightScale use, we don't store, we don't access as a part of our standard and contractual. There's just no time unless somebody hacked the platform. And those type of things that's in the risk assessment, so it doesn't fall into the BAA classification. But at no time do we have access to that. So from a legal standpoint, we're like the janitor. I mean, I hate to say that, but we're like the janitor, so we don't need to sign a BAA. Where if I was your cloud provider, you were using us for storage, that you actually used our database to store your protected healthcare information, then we would be.
What about RightScale professional services?
So the question is, what about RightScale professional services when I invite Phil into my account to do database maintenance and those type of things? And that's where it gets to be interesting gray area. So from a legal standpoint, and again, now I'm starting to talk a little bit, and this is being filmed, so I'm not a lawyer, but part of that would be is that in our agreement, it would say we want you to make sure we do not want access to the healthcare data. We'll help you debug the database, something like that, but please make sure and work in a collaborative effort where it is, if we did access it, would be in that incidental case. And if there was some point in time where we had to access healthcare data and it worked like that, then yes, the answer would be subcontractor and you'd have to sign it. At least from everything I've read. There's no wiggle room anymore.
I agree, because this is a typical case where if you're accessing anything, which I'm taking your database server, which is hosting my database, and it is hosted, or it's actually provisioned through RightScale. So typically you have the root admin access, kind of stuff, because it's actually provisioned through your web portal. So I'm getting you into that server. Though it's trusting, I trust you, but I don't know if the client trusts us or auditors trust us or not. Right?
And a lot of this is working through, and it'll be contracts and lawyers. But yes, so understand, as we spent quite a bit of time on this business associate part of the Omnibus Rule was a big deal. The other one the next one that I saw that I thought was very interesting, and again, just kind of solidified, was the preemption of state law. And effectively, HIPAA takes precedence over everything unless the state law is more stringent. So you can't say, oh, well, our law says we're allowed this. It doesn't matter. If HIPAA is more stringent, that's the federal law. It's going to apply. If your state laws are more stringent, which Massachusetts probably does have state laws that for privacy, for personal identifiable information or things like that, may be more restrictive. If they are, obviously state law preempts. So that was, again, they drew the line in the sand, said this is the way it'll be. So what that means is know the state laws of the places that you're operating in. Changes to the security rule, organization. You know what, I'm sure that this is an old slide deck. This is just irritating the crap out of me. Sorry about that.
So is the state law applicable to where the data is stored or where the entity is headquartered?
So the state law is applicable, I believe, to the person. So it's like if it's my healthcare information, right? And this gets back to so Massachusetts is a very interesting one. It deals, and I dealt with this. Massachusetts residents' information. If you expose it, you have a requirement to notify them. So in that sense, all of HIPAA stuff is really tied to the person, not the organization. So some changes to security rule, hybrid entities. They talk about hybrid entities needing to cover both sides. So if you're a hybrid entity that does a lot of things and part of your organization is a healthcare HIPAA compliant and you may contract with other parts of your organization, then the whole kind of business associate agreements, you have to consider everything within the hybrid organization itself. The other part is that business associates now have direct liability, and it's just the text to the, text of the language. Before, everything was covered entity, covered entity, covered entity. Now it says business associates directly liable. So again, Department of Health and Human Services can come after that. And then the business associate, remember that recursive subcontractors? It's just kind of the same thing, that business associates are responsible to manage their subcontractors and so on. Covered entity isn't responsible to manage the subcontractors of the subcontractors of the subcontractors of the business associates. So it's just kind of one level removed. And I think that's where the direct liability came in. Any questions like on the security rule changes? That was not really, again, there's nothing really huge that's come out. You do good security, as Mandeep was talking about, it's, for the most part, you're fine. You're good to go.
So, question. So it was the difficult part of the new Omnibus Rule that suggested, it was focused on marketing, and that the patient or whomever has the health information has to agree to allow you to marketing, where a lot of applications may be set up to opt out if you don't want marketing.
Yep.
And I believe that's where it's going to be stringent. You have to opt in to allow marketing as opposed to opt out. That was our group's interpretation.
Yeah. So the comment, and that's actually the privacy rule. So I'm gonna say there better be a slide that talks to that specific point, because that's probably, from the privacy rule, everything that I read, that is the biggest issue. Okay, so so changing the privacy rule, lots of definition changes, but limits on marketing was the big one, and that's what he was talking about, is that now it really is getting to the point where the patient's rights, it's like you have to get permission. There are some exceptions to that for like public health, if you can kind of, I guess, abstract it out. Things used for research, you can use it for research, but if you're going to sell somebody something, I just found out that you went in and got your knee operated on, and now I'm going to try to sell you orthotics, all of those things. As a patient, I would have had to say, that's okay. You can sell my information. And not only can you use my information, what you're going to use it for. So you don't get Granny who's sitting there, it's like, we just want to use your information. Okay, great. It has to say, we're going to use this basically to provide services or for other people. So it is trying to get people, and really, again, the good part is to try to get people to understand that they're giving their information out and what it's for. And then, again, for the privacy rule, because the privacy rule is the main part of HIPAA. That's the whole purpose of it. From the standpoint of protection is privacy. So it talks a lot about business associates and how they handle protected healthcare information and their direct liability. And again, most of this, it was just, there was never lines drawn in the sand, now there is. And really, if you remember, business associates are now directly reliable, and they have effectively the same responsibilities with handling protected healthcare information as covered entities used to. A lot of HIPAA just talked about covered entities. So now it's kind of like, hey, we've almost made the two the same. They're different, but we've almost made the two the same. And lastly, so that was pretty much it for the privacy rule, was marketing, what that information, and then what happens to business associates. The breach notification was interesting because there was, again, clarification. None of this was super new. Who was a business associate, that conduit exclusion, those type of things, they were. But stuff like that, they clarified the term breach. So basically, unlike in American judicial system, you are guilty until proven innocent. If there is a thought that you had a breach, then you've got a problem, right? You have got to prove that you didn't. Not, somebody doesn't have to prove. They changed risk of harm. So the term used to be, when you evaluated a breach, was there a risk of harm? Basically, was there a likelihood of something happening, right? Something, not that the PHI was compromised, not that somebody got it, but it was just how many people, everybody that got ball joints in their knees or something like that. There's no risk to anybody of that information leaking out. No more risk of harm. Now it says, what is the probability that protected healthcare information was compromised? Doesn't mean if it's important or not. whether you think it's important. If there was a low probability, right, then basically you're like, we're good. If it's a medium or high probability, then you have to kick into the breach notification. We'll talk a little bit about that. So the question I have for everyone is, if you're doing protected healthcare information, is do you have a risk assessment that you could find out as to what's the probability that that actually was leaked out? Do you have logs? Could you look at it? Because remember, if somebody claims that you had a breach, you are guilty until proven innocent. So you need to be able to prove that and say, hey, this is what it is, and have it in a reasonable way. And remember, the people that you're going to be proving this to are bureaucrats at the Department of Health and Human Services. It's not a bunch of tech people that you're going to be talking to, for the most part. Change unauthorized individuals, right, to unauthorized persons. And I don't remember exactly the specifics of that. I think it was because individuals are construed as individual people, and persons can actually be like entities. So it was just changing, again, terminology. And then how does a breach notification rule affect you? You need to be watching. It says, remember willful neglect. That's more for me. There's a term, and when you get, or if you get fined, if you have a breach and you get fined, there are different categories of fining. And the worst one, the one that will cause you the most pain, is if you were breached, you didn't fix it, and it was because of willful neglect. So you decided one of those requirements you're just not going to do. You were told that there was a breach, and you didn't fix it within a reasonable time frame. And I can't remember, I think reasonable time frame was like 60 days or something like that. And you just said, we're not going to fix it. At that point, you can be liable. The penalties can be up to $1.5 million per incident, like type. So the way I mentally, my visual picture is, you've got a cross-site scripting vulnerability that can be used to leverage a SQL injection to expose protected healthcare information. And you've got another cross-site scripting vulnerability that can be used to level a SQL. Those are two vectors into the same thing. Those are two different instances. So you could be fined up to $1.5 million for each one of them. And it's kind of 500 is a big deal. 500 records or 500 pieces of information is kind of a big deal. If it's less than 500 for who you have to notify, it's almost like, if it's less than 500, we don't care. They care. Yeah, I still have to do some stuff. But if it's more than 500, then people start raising some eyebrows. So any questions up to this point? I don't think. Oh.
So the question I'm wondering is on the breach side.
Is it on?
Let me turn this on one moment.
It's right on the middle. Yeah.
Is it on now? There we go. Any insight into who can ask? Because you're assumed guilty until proven innocent. Is that anyone that can ask? Or does it come from the Department of Health? And would they be from someone else? Who asks the first question that assumes you're guilty? Like, who can bring that up? Could anyone bring that up?
So in a sense, yeah. So yes. What I could do, now I couldn't ask you, I couldn't go to you and say, hey, I think you, what I would do is I would file a notice with the Department of Health and Human Services, say, I think that this is, so there is kind of a vetting. So it could be one person that says, I think my healthcare was information. They would report to the secretary, they'd go to the Department of Health and Human Services, make a report, and then somebody would investigate. And I don't know the intricacies in that. But I believe that there's that, at least a little bit of, are you crazy? Or, okay, this seems reasonable. And then an investigation would be started. Does that make?
Yeah, that seems like it could be pretty drastically abused if not thought through. But that's good to know. I mean, it's good to know how it comes through. That's all.
So the answer to the first part of your question, drastically abused, I'm thinking absolutely. People that just, it's a craziness. And again, right now, the rule's been set. People see stuff. It's like, I think of the word charlatans, man. It's just people out there trying to, so yeah, I can see that. I don't know if anybody else has actually had experience with a breach notification, but those, it is pretty good. And from my understanding, it can be a single person. that kind of starts it. But if a single person said it and then they looked and there was nobody else, right, there was no other reports, I'm guessing that, I'm hoping, right, that the Department of Health and Human Services would say, okay, where there's no smoke, there's no fire, so to speak. Yes?
Is that 500 item number, is that mentioned in the
Yes.
ruling? Okay.
So real quick, I've talked a little bit about this. So the validation category and kind of the fines, if you didn't know, it was something you've done decent security and you just didn't know that the vulnerability was there, something happens, right, for each violation, you can be up $100,000 to $50,000, annual cap of $1.5 million. And again, this is per instance of a vulnerability. So it's not like this type, it's each occurrence. Not each person or each record, but each occurrence. And usually the violation amount depends on a lot of stuff, how many people, those type of things. The 500 is specifically mentioned in Omnibus Rule, and it gets to who you have to notify and how. So this varies, and then if there was reasonable cause, right, you should have done something, right? You should have kind of been doing something, but it's not too bad, it was kind of there. This was you didn't know, but here was, there's reasonable cause. So it's, again, kind of limited. If willful neglect, you just said, I'm not going to do it. You knowingly didn't patch something, and it got exposed, and then you fixed it. So willful neglect, but then you corrected it, then again, $10,000 to $50,000 depend. And then if you willfully neglected something, PHI, and you didn't fix it within that reasonable time frame, it's $50,000 for each violation, up to 1.5 mil per year for that instance. Another instance, boom, boom, boom. So does that make sense? So we talked about this, so I'm not going to go through it again. So time frame, somebody had mentioned it, September 23rd of this year, right, is when compliance date is going to happen. And that's 180 days from the March 26th effective date. So they passed the law January 25th, March 26th, it went into effect, and now you've got 180 days to basically implement it and come into. And again, part of it, if you read the rule, it talks about the expected costs associated with this. And the part I don't know whether I like it. It's not like it, but it's kind of interesting, is they talk about the business associates, and they basically say, we understand that this is going to be a burden on those business associates to do this. We expect it to cost millions of dollars. You have 180 days. Thank you for coming. So it really is. Part of this I look at, again, up to this time, back to the rules have been set. Up to this time, I feel like people have been able to kind of move things around, figure out how do you do this. It's not there. Right now, you've got the government who really doesn't give a rip, right, about you, how much it hurts you, whatever. It's like these are the rules. And back to whether you're affected by it or not, that's roll the dice in a sense. So if you run into this, September 23rd is the date that you need to comply, that you need to be in compliance. And so this was kind of the thing. If you happen to use RightScale as part of this, I looked at it and said, hey, if I was a customer of RightScale, what would I use? The management features help you, monitoring, access control, audit trails. I mean, those type of things, get back to Mandeep's point, just help you provide a good governance and control framework, which, be it ISO or HIPAA or PCI or anything else, just help you kind of walk down that thing. Well, HIPAA compliance features can be tools. It can be something that that you can help. And in conclusion, rules are set. The Omnibus Rule, I think it's 130 pages or something like that. I actually enjoyed reading it, which is kind of interesting. Mostly because it's not fun, but the comment sections they're almost comical, because you got people saying, you're idiots. You guys there's no way you should do this, and the department come back and say, nah. So what? I don't care. You're going to do it. So it's not a very dry, but there are some very interesting things, and I'm thinking, wow. And good thing to read. Manage your business associates it's critical. I mean, that is, to me, that was the one overarching thing that everybody's going to kind of have to look back and go back to and figure out how to do that and do it in a right way, again, with their programs. If you're a business associate, you got direct liability and you have to manage your contractors. And I'm guessing that most business associates are not ready for this. That they're used to kind of, hey, we're not, and you're going to get, if you're a covered entity or a business, you're going to get all sorts of your partners saying, I'm not a business associate, I'm not me. And the other, I guess the last part is good security, as always, will cover most of what you need for the security rule. It's not, there's nothing tricky about it. It's, as a matter of fact, you probably mediocre security will cover most of what you need for HIPAA in a reality sense. So any questions? No questions. Come on, somebody's got to have. Nothing? Everybody is just so utterly amazed with the amount of information that came out. I know everybody, man, right now lunch is digesting, right? And it's like HIPAA after lunch, it's nap time. You're thinking about them RightScale beanies out there. I can see it. So I think with that.
When will RightScale professional services be HIPAA trained?
When will RightScale, see, watch this. Little soft shoe up here for you. No. So the answer to that question, again, I talked to our external counsel today because that's the area, and I think a lot of that is more going to depend on who we are, the contract with the customer that we're using. If it happens to be such that then the business associate agreement would be around that professional services thing and not, say, the platform or something like that. So it would be a very structured, and honestly, I'll say it, again, still being filmed, I have no problem. I believe in the security of the RightScale platform enough that I would personally sign a BAA. It's because in the reality is if somebody breaks RightScale and they can get to your PII because of a vulnerability in RightScale, one, I haven't done my job, and two, I have a lot bigger problems than somebody getting to your PII. And again, I'm confident in what we do. Yes?
Have you heard of any of the pharma companies trying to rally together to at least help this industry get comfortable with it and work with the attorney? Is there any kind of groundswell starting? Have you heard of anything like that? Or
so the question is have there been people in the industry that are basically trying to work together to make it easier to kind of get this and figure out how to do it? And the answer is no. And I think really, because it's only been a couple of months, I think people are still sitting there trying to figure it out, basically trying to cover their butts, making sure that they're good, and then over a period of time, I think maybe something will come out like, I hope not, with the purpose of maybe like a PCI DSS, the Security Council to help make a kind of a standard, help people do this right, but without all of the let's just be a thing that charges to make money. You know what I mean? To help. So I've not heard that. I know that there's a lot of customers that are working on that, bigger companies. So I'd expect it to come out, but right now, no. All right, with that, that's it. Thanks for coming.